Welcome back to the channel. My name is Thomas Fletcher and I'm the host of the LCSW network. If you're new to the channel, please do me a favor by smashing that like button, by subscribing to the channel, and by sharing this video with your social work colleagues and friends. The purpose of this channel is to create a community of hope and support where social workers can come together for relevant news, information, and inspiration. All right, so this is a continuing series of highlighting job opportunities for social workers in the VA. A great way to serve military veterans and to make a difference in the lives of military veterans. So last time I talked about the HUD-VASH program. Today I want to talk about the suicide prevention coordinator positions that are available on USA Jobs. Just a quick disclaimer, I am not being sponsored, endorsed, promoted by the Department of Veterans Affairs for this video, and there is no promise of employment by me making this video. Again, the purpose is to highlight and to educate you all about these job opportunities. If you are a social worker, if you're a psychologist, if you're a nurse, but I'm an LCSW, so I'm specifically talking to the LCSWs who are who have an interest in military social work, who are looking to get their foot in the door in the VA and to serve our military veterans. I will be identifying 3 positions that I found on USA Jobs. USA Jobs is very, very easy to access. So I just want to talk about these 3 different jobs. The first one is a GS-11 social work care manager in the suicide prevention department. So let me just briefly describe this position to you. And again, this is from USA Jobs. The suicide prevention case manager is a social worker who will serve to facilitate implementation of suicide prevention strategies to help ensure that all appropriate measures are taken to prevent suicide in our veteran population. The primary responsibilities of the suicide prevention case manager include monitoring a list of veterans determined to be a high risk for suicide or self-harm and coordinating enhanced care when needed, providing education to all frontline and clinical staff. There's a long list of responsibilities that I will not cover, but I think the summary that I just read is a good description of what the job entails. But let me go over the requirements briefly. Requirements: you must be a U.S. citizen. Random drug testing may be required. Selective service registration is required for males born after 1959. There is probationary period. Background security investigation, that's standard for all federal jobs. Must be proficient in written and spoken English. Selected applicants will be required to complete an online onboarding process. That's the HR. So let's go over the qualifications for this GS-11 suicide prevention case manager position. So I talked about citizenship. Education: you must have your master's degree in social work from a school of social work that's fully accredited by the Council on Social Work Education. Again, I have another video where I talk about the importance of the CSWE. Licensure: persons hired or reassigned to social work positions in the GS-0185 series in VHA must be licensed or certified by a state to independently practice social work at the master's degree level. Preferred experience: appointment to the GS-11 grade level requires completion of a minimum of 1 year of post-MSW experience equivalent to the GS-9 grade level in the field of healthcare or other social work related settings, either VA or non-VA experience, and licensure or certification in a state at the independent practice level. Let's go over the KSAs real quickly. Knowledge of community resources, how to make appropriate referrals to community and other governmental agencies for services and ability to coordinate services. Skill in independently conducting psychosocial assessments and treatment interventions to a wide variety of individuals from various socioeconomic, cultural, ethnic, educational, and other diversified backgrounds. Knowledge of medical and mental health diagnoses, disabilities, and treatment procedures, such as acute, chronic, and traumatic illnesses, injuries, common medications, and their effects, side effects, and medical terminology to formulate a treatment plan. Skill in independently implementing different treatment modalities in working with individuals, families, and groups who are experiencing a variety of psychiatric, medical, and social problems to achieve treatment goals. And the last KSA is ability to provide consultation services to new social workers, social work graduate students, and other staff about the psychosocial needs of patients and the impact of psychosocial problems on health care and compliance with treatment. So again, this is a GS-11 position, suicide prevention, social work position. This one just happens to be in Columbus, Ohio. Okay, so if you're in Columbus, Ohio, they need a suicide prevention social work case manager at the GS-11. And the closing date for this position is December 29th. Again, I will leave a link in the description below for these positions. The next position that I want to talk about is a GS-12 Suicide Prevention Coordinator social work position. This one just happens to be in North Bend, Oregon. Summary: the social worker program coordinator works within the mental health for VA Roseburg healthcare system in North Bend, Oregon. The social worker suicide prevention program coordinator is responsible for facilitation and implementation of evidence-based suicide prevention strategies for the Roseburg VA Medical Center's coastal clinics and acts as a community liaison for public health level interventions. And again, there's a long list of responsibilities that I will not cover in this video. The qualifications are pretty much similar to the GS-11. Licensure, you must be licensed or certified at the advanced practice level. So the GS-11, you have to be licensed at the independent practice level. GS-12, you have to be licensed at the advanced practice level. So advanced practice level, that's the highest licensure in your state. Some states have multiple licensure levels. California only has one licensure level. That's the LCSW, which is considered an advanced practice level license. Okay. Experience: 1 year of experience equivalent to a GS-11 grade level. Experience must demonstrate possession of advanced practice skills and judgment, demonstrating progressively more professional competency. Candidates may have certification or other postmaster degree training from nationally recognized professional organization or university that includes a defined curriculum, course of study, and internship or equivalent supervised professional experience. Individuals assigned as social work program coordinators must be licensed and certified at the advanced practice level and must be able to provide supervision for licensure. So let's go over the KSAs real quickly. Knowledge of program coordination and administration, which includes consultation, negotiation, and monitoring. Knowledge and ability to write policies, procedures, and/or practice guidelines for the program. Ability to supervise multidisciplinary staff assigned to the program. Skill in organizing work, setting priorities, meeting multiple deadlines, and evaluating assigned program areas. Ability to provide training, orientation, and guidance within clinical practice. So these are the KSAs for the GS-12 suicide prevention position. This one again is in North Bend, Oregon. Closing date for this position is December the 9th. The last position that I want to highlight is a GS-13 Suicide Prevention Coordinator position. This one is in Atlanta, Georgia. Let's go over the summary. The Suicide Prevention Coordinator is the coordinator of the Atlanta VA Healthcare System Suicide Prevention Program. He or she is delegated the responsibility and authority for ensuring local planning and coordination of mental health care and support to veterans who are at high risk for suicide. The SPC assists his or her medical center's administration and staff with improving identification of veterans at risk for suicide, as well as promotes early access to mental health care. And again, there are a lot of responsibilities that I will not go over, but the summary is a good description of what you can expect. Qualifications, again, citizenship, master's degree from a school that is fully accredited by the CSWE. Licensure, this one says licensed or certified by a state to independently practice social work at the master's degree level. The candidate must have at least 2 years of experience post-advanced practice clinical licensure. Okay. So for this one, you have to have 2 years of experience post your advanced practice license. Okay. And this is actually a supervisory social work position within the suicide prevention program. Let's go over the KSA's ability to independently organize work, set priorities, meet multiple deadlines, skill in a range of supervisory duties, which include clinical supervision, consultation, negotiation with other departments, and quality improvement. Ability to ensure provision of clinical social work services by supervised social workers. Ability to delegate authority, manage priorities, coordinate work, and follow up on pending issues to complete duties in an accurate and timely fashion. Ability to analyze organizational and operational problems, develop and implement solutions that result in efficient operations, and use data effectively to manage workload, quality, performance, and productivity within the service. And the last KSA is ability to provide staff training and development. For all assignments above the full performance level, the higher level duties must consist of significant scope, complexity, and variety, and be performed by the incumbent at least 25% of the time. Supervisory social workers at the GS-13 grade level typically supervise professional and non-professional staff. They are responsible for the professional and administrative management of an area in a social work service, in a care or product line, or across multiple sites. Incumbents may also provide direct clinical services. The preferred experience is 2 years or more experience as a supervisor or field instructor, and public speaking experience. All right, so this is the GS-13 supervisory social worker in the suicide prevention department at the Atlanta VA. And again, I will leave the link for this position from USAJOBS. So again, in conclusion, I just wanted to summarize that there are many suicide prevention positions currently listed on USAJOBS. It's a great way to serve our military veterans, to be involved in preventing the loss of lives of veterans. I think it's a really noble program, and they need LCSWs, they need psychologists, they need nurses. So give it some serious consideration, especially if you're whether you're a new graduate, whether you have 1 year experience. If you have 1 year experience, after graduation you can apply for the GS-11 positions, and on and on, So let me know your thoughts about this topic. I want to thank you for watching this video. For all the social workers and other licensed professionals, thank you for all that you do for your clients, for your agency, and for the profession. Please continue to support each other and yourselves. Bye for now.